The most important thing to me is my family, but I would like to be in good health on the way of getting old. I'm old now, but I don't feel old, just these little complaints that I have. I would like to be able to go to a hospital where you get a consultant that knows you and knows all about you, you know. As you get older, you don't want to be pushed around, you know, from one hospital to the other.
As the UK population gets older, the NHS is facing a growing number of older patients, just like Peggy, many of whom have complex healthcare needs. Our vision for the Newcastle NIHR Biomedical Research Centre is to provide personalised medicine for the older individual. We aim to achieve this through our world-class research facilities, integrating a core of basic biomedical science focused on the biology of ageing and chronic disease, with juxtaposed clinical research platforms. With recent NIHR investment, we're now in a position to pull through advances made in our research laboratories to have real impact on clinical care, addressing the complex needs of the older individual. One of our major strengths is that our research collaboration is based on one single NHS trust, one of the largest in the country, and one university with a long track record studying age-related disease. This has led to an effective partnership through a joint research organisation that holds the BRC mission at its core.
We have a joint business executive, a joint research executive and a joint teaching executive, all which deal with the joined up nature of our business. We really do very little apart. We do almost all of our business together.
There's a long history. The culture is there, the synergy is there, the ambition is there, communication is rapid, decision making is direct. We're very much together in Newcastle upon Tyne, a complete joined up outfit.
We have a large programme of research which is looking at the deep mechanisms of ageing. What is it about age that makes us more likely to fall sick? So what we have to do is to combine research that looks at these deep mechanisms of ageing and connect this to the fundamental processes that drive the ageing process.
The most important thing about the Biomedical Research Centre for basic scientists is the interaction with clinicians, which allows us to frame our work in such a way that we're tackling serious important problems. So in our area of fibrosis, which is scarring that causes organ failure in multiple organs, if we can find ways to halt or reverse the fibrotic process, then we can discover ways of actually preventing frailty in old people. What we've done is to discover signalling pathways in the cells that cause fibrosis, which we can now target with drugs to prevent the fibrotic process. And an example is that we've discovered that drugs that are being used at the moment to treat blood pressure can be used to reverse fibrosis in the liver. So that has come about by interaction between basic scientists and clinicians in the lab. Industry, particularly GSK, are very, very keen to advance what we do in the lab into the clinic. They want within 5 years drugs going into the clinic, biomarkers being tested in the clinic. The only way that we can do that really is through the BRC.
The Newcastle NIHR Clinical Research Facility is based within the Royal Victoria Infirmary. Its primary role is to support early phase studies and translational research, and this maps closely to the work of the BRC. We support a number of specialties with a particular emphasis on immunotherapy. It comprises 10 inpatient beds with near-patient monitoring, 6 consulting rooms, and a number of dedicated facilities, including an exercise lab, a DEXA scan, and a peripheral MRI.
Well, one of the areas of research I've been very interested in is stroke prevention through better treatment of hypertension in older people. What we showed in that work was that, contrary to general belief, the group where we more intensively lower blood pressure actually increased their cerebral blood flow, suggesting that intensive blood pressure lowering in older people is probably well tolerated and unlikely to produce falls or syncope or significant adverse effects. The clinical research infrastructure we have was critical to that study, because without the clinical ageing research unit we wouldn't have been able to do the fairly complex clinical assessments every 2 weeks, and without the MR centre we simply would not have been able to undertake the repeated MR scans with arterial spin labelling.
The CRF provides state-of-the-art clinical research facilities in an acute hospital setting. This is key to several of the early phase studies we plan to carry out, but it is not always the ideal place to work with the older person, requiring multimodal assessment in an old user-friendly environment. This is provided by the Clinical Ageing Research Unit, or CARU for short, which forms part of the Campus for Ageing and Vitality, designed with the older person at its core.
The Campus for Ageing and Vitality is a really happening area in Newcastle at the moment, comprising now a series of very new buildings. Up in the top corner we've got the bio and gerontology labs, which are obviously where an awful lot of biomarker work and basic science is going on. Adjacent to that we've got the brain bank, which is a wonderful resource with very well characterised brain tissue there, which has been accumulated over a number of years. Carrying on around the quadrangle, we've got the 3 Tesla MRI scanner, which is a dedicated scanner. And then here we're speaking in the latest operational edition, which is the Clinical Ageing Research Unit, CARU, which opened in June 2008, part funded by the Wolfson and the Wellcome Trust, and of course our infrastructure is provided through NIHR for the running of this facility. It was really geared from the outset at research in the older person. So in addition to the usual generic facilities like very well appointed clinic rooms and 1-bedded study rooms where we can, for example, give infusion treatments that may be involved in de-amyloid therapy for Alzheimer's disease, we also have a very large area of floor space for the GATE laboratory, where we have Professor Lynn Rochester doing some very interesting work using GATE as a biomarker, as a predictor of dementia. We have the DEXA scanner, which I'm currently sitting on, and we also have a visual perception laboratory, which has been looking at, for example, the relationship between how one's cognition interacts with how one would explore the environment around us. And we're now in the process of interfacing work going on in the visual perception laboratory with work that's going on in the GATE laboratory to see how this can synergize, if you will, between perhaps people with Parkinson's, for example, how they have difficulty with freezing and falling depending on their external environment. The final part of the quadrangle, which you will see, is actually the Biomedical Research Centre building, which has been funded in large part through NIHR funding. And that is going to be another fantastic facility which will complete the quadrangle and which will allow an admixture of business development, basic science and some very exciting new clinics to take place to really maximise synergy between clinical work and research. We're also now very, very active on the imaging side of things, correlating findings of MRI scanning in life with post-mortem findings. And these sort of research studies cannot be done in that many centres. You clearly need to have the ante-mortem clinical information, high quality MR imaging and access to the brain tissue resource, all of which we have got here and which we would be dependent upon NIHR funding to maintain.
I think training has to be at the heart of what we do. The critical thing from a training perspective about the campus is that you have all modalities of research in the same physical environment. And that's the essence of translation. You need to bring together groups with different professional backgrounds and different professional experience who can talk about their science and mix with people. And from that you get an interaction that brings perhaps a laboratory scientist into contact with a radiographer who works in the MR setting. And from those meetings and discussions and simple interactions, innovative and exciting projects will develop.
It's remarkable how far we've come since 2006. Starting with 7 independent research themes, we brought together the major clinical specialities into one functioning unit and focused squarely on the needs of the older individual as a whole. In Phase 2, our BRC will fuse the traditional hospital disciplines into 3 major disease themes: the ageing brain, the ageing body and the ageing limbs. These will be linked with cross-cutting age mechanism themes, thus creating a research matrix of personalised medicine for the older patient. With the initial NIHR investment, we are ideally placed to provide a unique platform for integrated, age-related translational research. We will train and nurture a new breed of translational scientists to capitalise on our world-class facilities, and we anticipate major advances before 2017 that will impact on the lives of each one of us.